Okay. Welcome everybody. We are on the penultimate learning session of our multi-agency child exploitation programme of learning. Absolutely thrilled that we've got Bex joining us from YorSexual Health, who's going to be talking us through for the next hour or so all about the service that they offer for young people. It's really lovely. I've seen some names already. I've recognised there's been some names from people who've joined us throughout the week. So if you've enjoyed the week or if you've found any sessions particularly useful, pop some things in the chat. It's always nice to capture that feedback from partners. You'll probably have been a little bit sick of me saying about this slide now, but please do get involved with Child Exploitation Awareness Day. It was Monday, but as a partnership, we would ideally like every day to be Child Exploitation Awareness Day. So keep promoting our messages on social media, keep promoting Be Aware Knowledge Hub, particularly across partners, young people, parents and carers and communities as well. You know, we've got resources for communities and businesses that will be useful for them on the website as well. Loads of stuff on the social media. Again, it's all there for you, so you can just like and share or follow us, and you can promote what we've been putting up this week. And this has been our menu, our programme of learning for the week. There's been some amazing sessions. We've had such great input from our partners and really good participation from those of you who've attended as well. So thank you. As I've said, we've got Bex delivering today. And then our final session is tomorrow, lunchtime at 12 o'clock. We've got Phoebe back from the Children's Society talking to us about financial exploitation. That one won't be recorded, so just bear that in mind and please join us if you can. We will try and keep the course slides, which I will put together in a bit of a pack of all the week's learning. But keep an eye out on our YouTube channel at MYSCP. I'm hoping to sort of put some of the recordings on tomorrow as well. And that's it. Again, please remember to add your name into the chat. I need that to log attendance for course certificates, and keep sharing feedback in the chat. You've got my email there, and you've got the QR code that will take you to all the Be Aware pages as well. Okay, I'm going to stop sharing and I'm going to hand over to Bex. Over to you, Bex, if you want to present your screen. Oh, I think you're on mute. Hang on.
I'll just say hello first, and then I'll pop on my slides. So,
perfect.
My name, I'm Bex. I'm the outreach charge nurse for YorSexual Health. Feel free to shout out or any comments in the. I won't be able to see the chat, and I can't see because you've all. I can't see any of your faces. So, but please be as interactive as we can. I appreciate that it's late on a Thursday. But yeah, I'll be talking about YorSexual Health and child sexual exploitation today for the next however long we see how we go. I won't go over an hour, I promise. And yeah, I'll get cracking. Any questions before I start?
Bex, I'll keep an eye on the chat for you. So if anything does come up, I'll give you a shout.
Super, that's great. Thanks, Kat.
Okay.
Right, I'll share my screen. Can you all see that okay?
Yeah, that's lovely. Thank you.
Perfect. So, YorSexual Health. YorSexual Health offers free and confidential sexual health and contraceptive services across North Yorkshire and York. We are commissioned by the local authority, and the current tender is through the NHS, York and Scarborough Teaching Hospital. So who are we? As I said, we provide free and confidential sexual health services across York and North Yorkshire to any person aged over 13. This includes contraception, emergency contraception, STI testing and treatments, support for people who've been sexually assaulted, PEP, PrEP, HIV care and counselling, and I'll go through that in more detail as we go through. We also offer free condoms and an STI testing on our website. How to contact Your Sexual Health. We have a central booking line number 01904 721111. We also have an under 17s text mobile number. It's a text or a call, but we appreciate the young people don't always like calling. And that's that number there, and that's Monday to Friday. And we have loads of information on our website as well. So where are we? Your Sexual Health covers the whole of York and North Yorkshire. We have hub sites in York, Selby, Scarborough, Harrogate and North Allerton, but we also run certain clinics on different days at South Milford, Malton, Skipton, Ripon, Stokesley, Richmond. So we do cover the whole footprint. Your Sexual Health offers phone consultations and postal treatments where appropriate. So we have clinics, as I've just said, in those hubs and spoke sites, but we also recognise that for some people, they can't, couldn't, or wouldn't access a sexual health service. We know that from what was Public Health England, now UKHSA, that sexual health is a public health issue, and that the burden of sexual health is not equally distributed across society. It disproportionately affects young people, LGBT groups, including trans groups, non-binary people, Black and ethnic minority groups, gypsy traveller groups, people experiencing drugs and alcohol issues, people who are sex working, and other groups that are on the fringes of society and more exposed and more disproportionately affected by poor sexual health, which is to say that that follows the trend of all health services and all health, that it's not equally distributed across society. But regarding sexual health, is we also appreciate that there is an inherent stigma, embarrassment. There's also a fear of what might be happening, and also an understanding and awareness and a knowledge around our bodies and sexual health that can make sexual health a really tricky thing for people to approach. So we also have an outreach team called SCOT, which is the specialist clinical and community outreach team, working with these communities that are most at risk of poor sexual health. And that's from 13 onwards. If you were working with somebody who was under the age of 13, it would be to still contact us, but the legal age of any sexual contact is over 13. But if you're working with someone who's 12 and who is at risk of poor sexual health, please get in contact with us. And we also offer lots of training and support, and we do lots of training for professionals as well. Our outreach team is made up of specialist nurses, clinical outreach workers and admin support. And the SCOT team that I'm the line manager of, we work closely with those at risk of poor sexual health, and that might be a young person who's been discussed at MACE, that may be a young person who's a looked after child, someone who's going missing, to somebody who may be at a PRU or not in school, to young adults, and to older people to adults and older people as well. So if you are working with, as a professional, working with somebody at risk of poor sexual health from 13 up, someone who can't, couldn't or won't access main services or needs support to access main services, you can refer to our outreach team via our Your Sexual Health website. So we are a young person friendly service. As I said, we see anyone over the age of 13. Your Sexual Health has a dedicated phone number for young people, and dedicated walk-ins in Scarborough and in York. And young people cannot, but also young people can access any of our other services, but that's we have a dedicated walk-in for young people. So most commonly sexually transmitted infection, or STI, is chlamydia. Chlamydia usually has no symptoms at all. 1 in 10 sexually active young people will get chlamydia. The best way to protect against STIs is through using a condom. You can easily test for chlamydia if with someone with a vagina, that would be to do a self-taken swab, or for somebody with a penis, that would be a urine test. If you're working with somebody with a vagina who would not want to do a swab, they can also do a urine test. It's just not as accurate. Treatment for chlamydia includes taking antibiotics and sexual contacts being treated. Other STIs and sexual infections: gonorrhea, also bacterial infection, HIV, syphilis. Syphilis is the highest rate it's been since World War One, and gonorrhea is the highest rate it's been since records began in the early 1900s. So we're seeing lots of STIs at the minute. HPV, human papillomavirus, genital warts are on the decrease, in part due to the HPV vaccine program. We see herpes simplex, which is also the cold sore virus. They just like to give it a scary name if it's to do with your genitals, but it is the same as cold sores. Trichomonas vaginalis, which is a parasite, which is passed on through skin-to-skin contact with friction. Pubic lice. We don't see a lot of pubic lice anymore. People tend to do more pubic hair topiary, so we don't see as much pubic lice as we once did. And scabies. Scabies is passed on also through skin-to-skin contact. I'm not here to scare you, but we know that there's drug-resistant scabies going around, so scabies that is resistant to first-line treatment. So if you're working with somebody who's moving, who may be in a transient, they may be sharing bedding, they might not, might be sleeping rough, that it is to an awareness that scabies is prevalent at the minute, and that it is an itchy, scratchy burrow under the skin, and we can help with that as well. The World Health Organization states that there's over 30 sexually transmitted infections. These would be the most common sexually transmitted infections that we would see within clinic, but there are a lot more. Condoms. So condoms are made of a very thin latex or rubber. We do also have latex-free condoms, and they're designed to cover a penis or a sex toy to stop fluids being transferred between partners and protect against against STIs. They also protect against unwanted pregnancy by stopping the sperm from coming into contact with the vagina. Condoms are brilliant, but they must be on from right at the beginning and right at the end. And we know that sex is never, I don't like to say the phrase, but it's never a dry situation. So we know that if you come into contact with any of that fluid, that's how sexually transmitted infections can be passed on, but also how the things like pre-cum so as well. So we would really encourage condoms on from right at the beginning to right at the end. An awareness as well that if someone is only using condoms as their only form of contraception, within a year, around 14 to 15 women will get pregnant out of 100 if they're just using condoms alone. I'm not going to do the video of how to use a condom, but I will. It's just a really short clip from the NHS choices, and I will share my slides with you so you can share this with if you've got any young people or if you need a refresher yourself about how to use condoms. I'm saying I'm not going to use a link because I tried it before we started this meeting and it didn't work for me. So but I am on an NHS computer, so yes, so I will make sure to send you the slides and you can have a look in your own time. Where can I get free condoms? So YorSexual Health has the condom distribution scheme, where individuals can order condoms that get delivered to their own homes, or an address that they are happy to have them delivered to. As part of an organisation, you can also sign up to the condom distribution scheme if you haven't already. please go on our website and you'll find the information there. There is a training package that goes along with that. It's free training, and I would recommend to sign up to it. The training tells you all about how to speak to young people about condom use as well, and you can give out free condoms, which would be great. So, yes, there's links to that in the PowerPoint as well. It shouldn't be a deterrent, the cost of a condom for young people to access condoms, especially when they are free. But it's about young people knowing where to get them, and that's half of the battle, and half the message that we're sending is that you don't have to go into Boots and pay a fortune for them. In North Yorkshire and in York, you can get condoms for free. So STI testing. So it is important to use a condom every time for sex, as I've discussed, as it can reduce the risk of STIs and unplanned pregnancies. Oftentimes, we will have patients say, well, I haven't got any symptoms, so I ain't got out, or she was clean, or I don't go with dirty girls, or any of this thing. I'd love to know how they must have microscopic vision to see the STIs that they're looking at, because it's this misconception that you'd have green discharge pouring out of you to have an STI. Most STIs have no symptoms at all, but 1 in 10 sexually active young people will get an STI. So it's about getting into a habit, a regular habit. If you've changed sexual partners, to test every 3 to 6 months. If, for example, we'll call him Bob, Bob had sex today and it was a first time having sex with a new person, and Bob's like, comes to the sexual health service and goes, I need to do a test. I had sex with Barbara today. The earliest the chlamydia test is going and gonorrhea test is going to be accurate is 2 weeks after sex with somebody new. Before that time, they may have an STI, but it won't show up on the test until 2 weeks after that first contact. If they've been having sex with somebody for a while, then we'd be happy to test. But if it's the first time with somebody new, they need to wait 2 weeks, just because that's how long it takes for the test to become accurate. As I said before, the test is not painful. It's a self-taken swab or urine sample. If somebody does have symptoms, we would advise that they contact ourselves, YorSexual Health. And if someone has been told that they have come in contact with an STI, they also need to ring YorSexual Health. So we offer a whole range of contraception as well. We offer the pills, so that's the combined pill, the progesterone-only pill, the ring, the patch, and we also offer long-term contraceptives methods such as the implant, the injection, the copper coil, and the hormonal coil. We also offer diaphragms and caps, and as I've discussed, we offer condoms as well. We also offer emergency contraception, so that's for if you've had unprotected sex, a penis and a vagina without contraception, the condom broke or contraception failed, you may be able to prevent an unplanned pregnancy by using emergency contraception. We would advise that it is important to access emergency contraception as soon as possible. If you're in North Yorkshire, then certain pharmacies do offer free emergency contraception. But you have to check with that pharmacy because it depends on the pharmacist if they're available. You can also get it from the GP and YorSexual Health as well. The most effective form of emergency contraception is the copper coil or the IUD. This is because it's the coil, the T-shape that you can see, and it's sprung with copper, which is that kills the sperm. So that's how that works. And then we've also got probably the more commonly known morning after pill, which can be used, the way it's used is to prevent ovulation. So if a person has already ovulated, it may not be effective, but we can't tell if someone's ovulated or not. We have a guide that says it'll probably be around day 14, but we can't say for sure when somebody's ovulated in their cycle. So the way that the emergency contraceptive pill would work is to delay ovulation. And don't like the term morning after pill, because you can take it up to 5 days after sex, but it is most effective taken as soon as possible. The effectiveness does decrease as you get closer to day 5. We also have LGBT support at YorSexual Health. Our service is committed to a friendly, safe and inclusive service for everybody, regardless of gender and sexuality. We support young people and adults to access safe, non-judgmental and good sexual health care. We're collaborative with LGBT communities to ensure our services are open and supportive and regularly ask for feedback. We will use a personal identifier, and that's your chosen name and your gender identity. And our clinic has a mixed waiting area, but our treatment rooms are not gender specific. And we do host dedicated trans and non-binary clinics as well. And we, as part of the outreach team, do have offers of one-to-one support and support to start LGBT groups or support somebody one-to-one regarding their sexuality as well. So just a quick one about PrEP. So PrEP is a medication that you can take to stop yourself from getting HIV. This medication is free. It's on the NHS, but you can only get it from sexual health services. It is the same medication that people who have HIV take, and we give it to the most at-risk groups of acquiring HIV. That includes people who are having unprotected anal sex and people with a HIV positive partner. We also have PEP. I like to think of it a little bit like emergency contraception. That's how I think it's easiest to get your head around it as well. It's a medication that can be taken within 72 hours of a potential exposure to HIV. It's a 28-day course of medication to prevent you from acquiring HIV from a sexual contact. And you can get that from your nearest sexual health clinic or A&E, and that can prevent you from acquiring HIV. We also offer lots of vaccinations as well, such as Hep A, Hep B and HPV. Regarding sexual assault, we would advise that the contract for support for a sexual assault is via Mountain Healthcare in North Yorkshire, and they have a 24-hour advice line, as they are able to provide the full emotional, physical, psychological support. However, if you are working with somebody who absolutely didn't want to go through Mountain Healthcare, then we're here as well for advice and support and able to support somebody through a sexual assault after a sexual assault. Would say as well is that going to Mountain Healthcare and which is also called a sexual assault referral centre, does not mean that that person has to tell the police. If there is safeguarding concerns and if it is a young person, there may be a safeguarding element of that. But if they didn't want to press charges or go further, then that is an open discussion. But that would be a safeguarding discussion rather than if you want to go to Mountain Healthcare, you have to tell the police. We also have counselling services for people living within North Yorkshire and York who wish to seek support around different aspects of sexual health. It's a self-referral via our website, or you can be, as a professional, you can refer somebody, or one of our staff can refer patients as well. And this counselling can be face-to-face, online, or via the telephone. As I said before, so to get in contact with us, you can ring 01904 721111. For under 17s mobile, that's on the screen now. And for all the information that I've discussed today, it's all available on our website. And if you don't already, I would really recommend following us on social media as well. If I can remember the handle now. It's YSH York N. Yorks, but I'll put that in the chat as well. So we have spoke at the beginning around the Scott team. We do work closely with Mace. We work closely with social workers as well. But part of our routine inquiry for all people under the age of 18 is to do a spotting the signs, which is a thorough assessment of any safeguarding concerns, whilst Fraser competencies and Gillick competencies, which are a set of guidelines which mean that we can provide sexual health care and contraceptive health care to under 18s as long as they have capacity, understand it's in their best interest. We can't persuade them to inform their parent or guardian, and they will continue to have sexual contact. That is the guidance of which we can provide sexual health and contraception health care. We do a thorough risk assessment on all under 18s, and that is around school, how they're feeling at school, how their mental health is, any we ask around gifts or money for sex, if they've ever felt pressured into sex, any coercion, and we do highlight to all our under 18s that although this is a confidential service and we are able to provide contraception and sexual health care, that confidentiality is conditional, and that if we do have any worries or concerns, that we will discuss with them, but we may need to highlight to safeguarding as well. So as much as we are an open and friendly service and we see a lot of young people, safeguarding is imperative to our role as well. So that's my presentation. So I will stop sharing my screen, and any questions?
Please feel free to pop any questions, or just pop your hand up and turn your microphone off for any questions for Bex. Bex, I've got a question if that's okay.
Yeah.
I'm just wondering, I've asked this of most of our partners through the week, but if you're picking up any particular themes or trends in relation to young people who are accessing the service. So, you know, particularly with linking to exploitation or anything like that, but just if you're picking anything up that's worth sharing, really.
Any themes, trends? We are seeing a reduction generally in young people being sexually active, which is being highlighted, I think, on the BBC News, and less risk taking than maybe the previous generation. So we have seen that, which is quite interesting. That the sexual risk taking is actually and people's first time having sex as a country is actually increasing, which has been quite interesting. We are seeing, however, that there is still young people coming to our service still. So although we've seen that there has been maybe a decrease in first time sex and interest in sex as well has kind of maybe decreased over the last 5 to 10 years, that we are still seeing a lot of young people. In terms of themes, at the minute, we had seen pockets of we do follow Mace, so we have seen pockets across the patch, but they're more cyclical than anything, and they're not. We get little pockets of infections across and then they kind of die down again, and then so yeah, no real themes at the minute. We are still getting a lot of referrals, but we are to our outreach team, but we're always happy to take more referrals on.
Thank you. Bex, do you think like the online world has changed relationships for young people? Because obviously young people are meeting and talking to each other online, and you know, when we're looking at this through an exploitation lens, it's a big theme for us in the mace
Absolutely.
world around those relationships online. Is that something that you kind of come across a bit more now?
Yeah, absolutely. And Snapchat and TikTok are the worst. They're really challenging, and I think we are finding as well is that that's still that persistence of young women and girls having sex, and that being quite, and sexual images is they go around schools very quickly, and that can be really detrimental to a young person's mental health. I think, I don't want to sound really old, but if I got bullied at school, the bullying stopped when I was at school, and I went home and I probably watched Neighbours, and it was all okay because I was at home. But now, and I'm sure that a lot of you have these same conversations with your colleagues, is that now it doesn't stop, and image sharing is quite prolific, and we're seeing that among our young people, and also seeing a lot of mental health as well. Um, and I do think personally, but it's my own opinion, is that they are linked, is that, this kind of constant communication and online harm is a real concern, and the amount of self-harm that we're seeing as well. I think they are interlinked.
It's an ever evolving picture, isn't it? And I know
Yeah,
from a mace point of view, we do try and keep an eye out on those emerging trends. And like you say, Snapchat is always a big one for us in terms of how young people are communicating because of the slightly different nature of just having a snap that will disappear. Often we'll find that you'll get perpetrators who target young people on other apps or even through gaming platforms and then ask
yeah,
them to come across to Snapchat as well.
yeah,
So that's
definitely.
something just to be mindful of.
Yeah,
Does anyone else have any questions in the chat for Bex?
just picking up on what you said then, Kat, as well. I just had a thought, is that we often think this is image sharing, um is as heteronormative, so between girls and boys, or an older male to a younger girl. And I think we need to get away from that binary. We have had spits of young younger boys, teenagers, male teenagers, sending images, and we've also had um, non-binary and trans young people, and image sharing as well, and with people from the internet as well, and pushing those young people maybe out of to the fringes, as because this sort of CSE becomes even more sort of secretive. So I think
Mm,
it's that awareness as well, is that it's not binary, and the it's not just girls to teenage boys, or
yeah,
teenage boys to teenage girls, but also, and not just the age, but also trans and non-binary people as well, um and also same-sex image sharing as well.
yeah. We had a really good session yesterday by the Children's Society who did an hour on online sexually coerced extortion. So that exploitation side of that image sharing, which you'll often see through that boyfriend girlfriend model, where you've got someone who kind of develops that relationship and exploits that young person to share a nude or a sexual image, and continues to exploit them by saying they're going to share it further or wider and ask for more images. So again, given the emerging trends and the continually emerging trends around the online world, it's definitely one to be keeping an eye on. Okay, looks like there's nothing coming through in the chat. I'm always conscious that some people like to ask questions when the recording's finished, so I'm going to stop the recording, and then Bex and I will stick around for a few extra minutes and happy to take any questions.
Yeah, absolutely. And I've bobbed into the chat as well. So is that if you are working with any young people, share far and wide. This got I've popped a link for the Scott team for if you have any referrals and you're working with any young people and you want to make a referral. It's a really it's a really easy referral online. So that's all popped in there for you, and you can have a look on